the rostral end, the caudal end, the cranial cavity, the nasal cavity. Now, one of the structure is removed to expose this side of the nasal cavity, which was extended from caudal to the rostral end. The nasal septum has been completely removed. And so after removing the nasal septum, we see the nasal concha. Along the dorsal side, along the dorsal aspect of the nasal cavity, we see the dorsal nasal concha. Then we see the ventral nasal concha, and further extension of the ventral nasal concha into the vestibule of the nasal cavity, that is the alar fold. As we come further backward, some of the extensions coming from the ethmoid bone and merging with the ventral nasal concha, these are the middle nasal concha. And then going further backward, this is all your ethmoid conchae, which are present at the caudal-most aspect of the nasal cavity. Remember, the caudal end of the nasal cavity is the cribriform plate of the ethmoid bone, and so these conchae are coming from the ethmoid bone, so we call them ethmoid conchae. Now the passages formed because of the presence of the conchae. The space between the dorsal nasal concha and the roof is the dorsal nasal meatus. The probe is now running through the dorsal nasal meatus. Then we are going through the middle nasal meatus, and then the ventral nasal meatus. The ventral nasal meatus is the largest space, which is going to lead to the choana or nasopharyngeal opening on that side. That's the choana right there, opening of the nasal cavity into the nasopharynx. Now into that nasopharynx we see an opening right there. Okay, I'm trying to push the probe through that opening. What opening could be that? We discussed that slightly during our discussion of ear. What structure could be that? Yep, that is your pharyngeal opening of the auditory tube. And that's how the auditory tube or the middle ear is connected to the external environment by means of having that opening of the auditory tube placed into the nasopharynx. Then continuing further backward, we have the nasopharynx, which will continue further towards the larynx and all, but then that part we will discuss on the other specimen. The sinus that we see right here, little hole is made with that sinus. So that is your frontal sinus. Remember, in the dog, frontal sinus, 3 compartments. In the cat, it is single big sinus. Let's go to the other specimen. So in this specimen now, we see similar structures, but then the conchae as well as other structures are not well exposed here. But then we have the sinuses very well exposed. That is the frontal sinus with compartments. Okay. The rostral, middle and lateral rostral, medial and lateral compartments. Now let's come back to the nasopharynx. So the nasopharynx, we saw the pharyngeal opening of the auditory tube, which then continues further backward. Here we have the hard palate, and then continued backward we have the soft palate. Now I'm going to point out 2 important structures. If I try to pull the soft palate more ventrally, I see there is some connection between the pharynx and the soft palate, and that arch is called palatopharyngeal arch. And if I try to pull the soft palate upward, then looks like it is connected to the tongue by means of palatoglossal arch, and that demarcates or that forms the caudal-most boundary of the oral cavity. So palatopharyngeal as well as palatoglossal arch. Right behind that we have the oropharynx. Then this is your nasopharynx. Then this is the larynx right here. So the space above the larynx is your laryngopharynx. Make it like take the full view of the head. Yes. And so that is your laryngopharynx. Connection between all these cavities, we call it common pharynx. Now let's look at the structures of the associated with the larynx. The epiglottic cartilage is not cut, it is completely intact. The thyroid cartilage, the lamina is gone, but the ventrally, the connection between the laminae is still present there. Then the cricoid cartilage, part of that is missing. dorsal aspect of the larynx covered by the mucous membrane, and we have the muscles located below that. That is your cricoarytenoideus dorsalis, the muscle which is responsible for opening the glottic cleft. Then ventrally we see other muscles associated with the larynx as well as the hyoid appendix. Now let's open the larynx and look at the cavity of the larynx. So as I take the section along the dorsal or along the roof of the larynx, I can now open the laryngeal cavity. Again, in terms of directions, rostral, the epiglottic cartilage, and caudal. So this is the vestibule of the larynx. Can you all see that clearly and make sense out of that? It is not getting confusing in terms of orientation and directions. Okay, just keep following that. So that is the rostral end where we see the epiglottis, and so that space is your vestibule of the larynx. Then as we come in the middle part, we see the glottis, and then as we go further caudally, we see the infraglottic space. Now in the glottis, we have an important structures. So we have the fold which is present right here. That is your vestibular fold, and the fold which is located behind that, that is the vocal fold. The space or the opening which is present between the vocal and vestibular fold, that is the opening of the laryngeal ventricle. So now I am placing the probe right through the laryngeal ventricle. I am trying to reach the space of the laryngeal ventricle. Okay, so that's your laryngeal ventricle. That is vestibular fold, and that is your vocal fold. What is the other name for the laryngeal ventricle? The saccules. Okay, so saccules is the sacral or saccules, both of them. That would be another name. At this point, we see some sort of mucous membrane has been everted. That is part of the laryngeal ventricle. We can push it inside, and we can see the opening of the laryngeal ventricle on the other side as well. Okay, laryngeal ventricle, laryngeal ventricle. Going further backward, we have the infraglottic space, and from that point onward, we have the further continuation of the trachea. Now coming to the cartilages, the epiglottic cartilage, the thyroid cartilage, only part of that could be seen. From inside, we can see the arytenoid cartilage. That is, these are all the parts associated with the arytenoid cartilage. But then at this point, everything is covered by the mucous membrane, so we cannot see the cartilage itself, but we see the area where the cartilage will be located. That's the dorsal lamina of the cricoid cartilage, which has been cut because we open the cavity of the larynx from the dorsal aspect.